Well, Dr. Jillian Horton is an author and physician and a specialist in internal medicine at the Health Sciences Center in Winnipeg. Dr. Horton, thank you so much for joining us.
My pleasure, Natasha. Nice to be with you.
Well, Happy New Year, and let's try to make it a better year than it was last year. Beginning with these numbers that we're seeing when it comes to Omicron, do you think we've hit the peak and we're going to start trailing down, or what's your assessment at this stage?
Yeah, I don't think we have. I think the situation is so fluid, it's impossible to tell. Across the country, many of us are at different points. Manitoba is behind numerically and case-wise where everyone else is. But I think the worst is clearly yet to come. And in particular, with the lag that we always see with hospitalizations, we have not yet begun to feel the full effects of what is about to happen.
Dr. Horton, remind us, because this is a national audience, what are the numbers like right now when it comes to COVID cases, the ICU rates, and are you at a point where you can still manage?
Yeah, well, as one of your guests or one of the clips was saying earlier, there's now a complete disconnect between the numbers and reality, and we have to start looking at other markers. And in Manitoba, we have a test positivity rate of about 30%, but a massive shortage of PCR tests, and also a really poor distribution of those personal use home tests. People have a hard time getting their hands on those. So who knows what the actual numbers are? We have not yet seen a bump in demand for ICU beds. But again, it's really early. We know in every other wave that has come late. And we also know that the more cases we get, even if this is a more mild disease, as much of the data is saying, that number of hospitalizations doesn't show up till a little bit later. So numbers are poor here, just like everywhere else, but we're also bracing for the worst. In terms of hospitalization and supports and resources, our hospital situation right now is like many other places, pretty much everywhere in the country. We're playing musical chairs, only we're playing it on the deck of the Titanic. So we say we have ICU capacity, but we're moving resources from every other place in the health system. Nurses from clinics, nurses from surgical beds, those who normally support post-operative cases in so-called elective surgeries. So in some sense, that idea of whether we have capacity, it's semantics. We're putting all of our resources into one column and not really advertising the fact that they're being removed from other places where they are needed every single day.
Oh my gosh, Dr. Horton, that's a lot to absorb. The Titanic comparison really hit home. So, if you don't think, and so many people agree with you, that the case counts at this stage are sort of irrelevant, they just give us a snapshot or a sense of where we're at, we can't really rely on the numbers of the hospitalizations and ICUs because those lag behind. We've heard from several doctors that at this stage, the rapid home tests don't really mean anything because if you're positive, you have to get a PCR. If you're negative, it doesn't actually mean that you're negative. So what should we be using to measure where we're at, or just forget about measuring and move on to the next stage? And if it is the next stage, what is that stage?
Yeah, a great question. I mean, lots of people have talked about using wastewater testing as one of the metrics. Absenteeism in schools, if we go back to schools, will probably be useless because many people will be keeping their kids at home. So I think when we step back and say, what is the average person able to do? What can we do? I mean, we have to reduce our contacts. Our government in Manitoba, anyway, has clearly indicated they are not willing to take the bold steps like the ones that have just been taken in Quebec to protect Manitobans. And frankly, I no longer believe that the vast majority of advice coming out of government is credible in any way. They're telling us that everything's fine. Let me tell you, the people on the front lines and the advice that they are getting behind the scenes is not that everything's fine. So what can we do? What should we be doing? I guess we look back to the individual level. We say, let's control what we can control. We're the best possible mask that you can, an N95 or a KN95 if you can. That's not fair. A lot of people can't afford them. Our government should be providing them. And then the second thing we can do is stay home at every single opportunity that we have, limit our contacts, try to make this wave occur more slowly, try to protect ourselves and not buy into the idea that it's inevitable that we'll get COVID, focus on our air quality, ventilation, filtration, do what we can in that respect. disinfect in environments like schools when kids are going to be present in them, daycare centers, and hold on, because we are in for some very difficult months.
Okay, I'm not joking, Dr. Horton. My stomach is hurting having this conversation with you, and I know that that's not your intent, but so I'm sure that I'm not alone in this, right? And it's been 2 years of us grappling with this, and in some ways 2021 hurt more than 2020 did, because we thought, oh, now we've got the vaccines, we're out of this thing. And you know, you're offering us this suggestion that you don't believe what government officials are saying, which is a pretty serious thing. So this whole notion that it's going to get really bad, and people need to protect themselves, a lot of people have just hit their limit. They said, look, I got the double vax, I've gotten my booster, now I'm going to live my life. I'm not going to have doctors or politicians tell me what to do. How do you respond? Because people do need hope. It might get bad in the next few weeks, but what are we looking forward to? So let's project a little bit further.
Yeah. So the first thing I just want to say is I get that. I get that feeling where you start to think, what does it even matter? I'm just going to live my life. I'm going to go out. I'm double or triple vaccinated. I'm going to get Omicron and everything's going to be okay. And I understand that feeling. That's a totally human reaction. I am fed up with this. I'm sick of this. I'm sick of this, how it's impacting my kids' lives, my neighbors' lives who own businesses, my colleagues and friends' lives in healthcare. So just first of all, to normalize that feeling, to say that everyone is feeling it. But the second thing is, you know, really when we look at this, I don't think any of us are saying this is inevitably going to be the situation for 12 months or the future. I'm talking about looking into the short term. What do we need to do so that we have a healthcare system that is there, not just if you get COVID, if you have a heart attack, if you are diagnosed with a new cancer, if you have a bleeding stomach ulcer, if your elderly beloved mother or grandmother fall and break their hip. We have to buckle down to make sure that there is something left within that healthcare system to treat all of those people properly, not just the COVID cases. And if the system is completely overwhelmed by a lot of people needing acute care all at once, as I said before, all resources get moved into that category of supporting the COVID patients, and all other forms of care are impacted. So really, we can look at this in the short term and say, you know what, the next 6 weeks are going to be hard. I do believe after that, it's going to get better. It's going to be hard in healthcare for the next few months, but I do think we just have to say, take a short-term view. This is, can I just say one other thing, Natasha, when it comes to the comment about not believing what government is saying, the biggest thing I want to say that I don't believe is when they say everything's fine, we have the resources, we're in control. Those are the things that are not true, that I want the public and colleagues to continue to question when it comes to our response to this crisis.
Okay, we'll keep doing that. Dr. Jillian Horton, physician, joining us from Winnipeg. Thanks so much for your time.
Thank you.